So happy to welcome you and see you. I'll finish the introduction first, and I think for all the viewers, I'll introduce the platform as well as I'll introduce Dr. Sudhir Kumar. So I'm Shashi, a certified metabolic health coach from D-Life in India's first and only award-winning low carb platform. So this D-Life was founded in 2014 by Anup Singh, who is an IIT silver medalist and also Icons of India awardee. He also pioneered the low carb movement in India quite some time back with Anup's groundbreaking 100 grams carb limit per day max protocol, which has helped many people adopt this low carb diet in India, especially for diabetes and other metabolic disorders, and especially suitable for vegetarian clients. So in 2020, he also launched a D-Life diploma course, the only legally tenable course approved under the NSDC partner government of India in this segment, which is also having the world's largest 144 massive CPD hours. None of the courses have this. So Anup Singh and me, we both organized this India's historic metabolic health conference back in 2023, then in 2024, and now in 2025, the third one. So it gives me great pleasure to introduce Dr. Sudhir Kumar. He's a neurologist, a mainstream neurologist, widely known as Hyderabad Doctor in X. And he's a distinguished neurologist based in Hyderabad, India. With extensive clinical experience, he's recognized for his evidence-based approach to neurological disorders, emphasizing the role of nutrition, lifestyle, and micronutrient optimization in the brain health. So Dr. Sudhir Kumar actively shares medical insights in social media, challenging conventional wisdom, advocating for patient-centric care. He makes a lot of educational videos for general public to understand things very easily. His expertise in metabolic and neurological health makes him valuable voice in bridging the gap between the traditional neurological treatment compared with, mixing it very well with the holistic intervention as well as the modern approaches also. So he is well known. He appears in many media. Whenever something on health crops up, the comment of Dr. Sudhir Kumar has to be there. And he makes it very easy for the lay person to understand. And I think he's been awarded by the medical community also for such social activities. Yeah, Dr. Sudhir Kumar.
Yeah, thank you, Sashi, and thank you, Anup Singh, sir. So definitely, it's my pleasure to be here, and I know you have been doing it for the last 2 years. This is the third one, and it is one of the most popular courses and conferences that you do, and all web-based, and it's all free for public to gain the knowledge from. So I think it's a very noble initiative, and I wish you all the success, in this edition as well as in future also.
Thank you, Dr. Sudhir Kumar. See, I was always fascinated while reading your post in X about the burning issue in India. One of the biggest burning issue in India is the micronutrient deficiency. We have macronutrient deficiency also, which will come later on. But micronutrient deficiency seems to be very widespread, especially the deficiency of vitamin B12, vitamin D, in females, iron, maybe others also like folate and all. And what we see as coaches when we get mentees or clients, we invariably find 100% deficiencies of B12 and D unless they are supplementing. If they are supplementing, they are at some level. If not, let me tell you, it is 99.9% they are deficient. Why do you think this is happening? What is the reason? How much of these deficiencies you find in your practice?
Yeah, I think you have brought out a very important topic. And as you mentioned, both B12, vitamin D, and iron, these deficiencies are common. So many people ask me, doctor, why these things have become more common now? Are these all pharma driven because they have made a lot of supplements? So are they driving you to diagnose and then treat? So then I tell them, luckily I trained at CMC Vellore, which has a very good emphasis on public health also. So we used to go to villages, look at people's life in the villages, what they eat. We had to spend few days in staying with them in the villages, so we saw things from very close quarters. And I think the fact that mostly women are iron deficient in India, it is well known, even from the well-to-do families, and we blame it on their menstrual periods, but menstrual cycles are normal, so obviously there is something more than that. It is mostly the diet which is deficient in the iron also. And same thing, vitamin B12, we published so many papers because right from 2003 onwards. So then I tell them, see, it's not something new. So you just Google and in the PubMed, you'll find our research papers from CMC Vellore. So it was common then also, And then, only thing what has changed now is that we were taught that only those who are poor, who have poor nutrition, they can get these deficiencies. But when I became a doctor, I realized that even people from well-to-do families, who are good, who have enough money to eat good food, they also are deficient. So that is the
Even
paradigm.
doctors are deficient.
Yes. So doctors are deficient, rich people are deficient. So this is one thing which doesn't differentiate doctor and non-doctor, rich and the poor. Everybody can be deficient in vitamin B12, vitamin D, and iron. And also I can add thiamine deficiency, which is not so common, but yes, we do see many people with thiamine deficiency also.
So how do these deficiencies affect people neurologically? So how much of it you see in practice? Do you? I see a lot of such unique stories in your Twitter feed. So how common is it? What are all the neurological impairment it causes? And I'll ask further question on this.
Yeah, basically, vitamin B12 deficiency is quite common. See, when we are trained, when we are looking our DM neurology subject, so there this nutritional neuropathies or neurological disorders due to micronutrient deficiencies, that's not a major portion. Maybe it is less than 2% of our entire curriculum. So when I investigate that first and find that and treat that, patients get better. Then many of my seniors used to shout at me, why are you not thinking of all the uncommon and rare conditions first? You should look for vasculitis, look for autoimmune diseases, look for sarcoidosis, all those things. I said, see, if I look for B12 deficiency and I treat that, it saves time, cost, and money, and patients are better. So if you look at the deficiencies, I think in our practice, neurology, B12 deficiency is the commonest, and the commonest will be neuropathy. So patients come with tingling, burning, numbness of the feet, and then other thing is the higher mental functions. So if many youngsters they come saying, doctor, I can't focus, I'm not attentive, I'm not doing well in studies, I'm not doing well in the job, then one of the things I think is can it be B12 deficiency? And many times we found that, treated that, and then their performance in school, college, and work, everything improved. And there's one story I always remember, just briefly, I will tell that story also. So it was a Bengali gentleman who had brought one woman. So he was dressed in a suit, tie, and everything. And the woman was, not even wearing footwear, crumpled dresses, hair also not combed. But he said, no, she's my wife. And she looked like a foreigner. So he said, yes, she was an air hostess in Lufthansa Airlines. And I was a frequent flyer. So I just kept meeting her a few times. We fell in love and married. But then, she was not like this. She was very pretty earlier, but last 6 months, she doesn't remember. She forgets everything. And recently she got lost in Calcutta. And then, with great difficulty, after 3 days, we could find her. But nobody could find out what is happening to her in Kolkata. So we brought her to Vellore. And when we investigated, her B12 was very less. It was only about 40. So much low. And then we said, and they had already done the brain scan, everything which was normal. So I said, okay, I will not do anything else. Let us start this B12 injections and tablets, and then we'll review. So then I forgot about that. So only in the busy OPD, I'm sitting, and then I see, one gentleman walking in. I could recognize the man immediately, but the lady with him I couldn't recognize. He said, "No, doctor, this is the lady who I had married, and not the one you saw last time." So totally transformed from somebody who was demented to this. So definitely in an untreated case, it can cause severe dementia, which can mimic Alzheimer's disease also. And then it can affect optic nerves, visual problems, imbalance, especially if the light is not enough. So that's about B12 deficiency. Rare manifestations can be tremors. It can mimic Parkinsonism, even seizures. So basic and neuropsychiatry. So many people they become ill-tempered. They start shouting. They agitated. So even frank psychosis can happen. So neuropsychiatric manifestations are common. Of course, we all know about anemia and the skin changes, pigmentation that can happen with B12 deficiency. Looking at the iron deficiency, it is mainly linked to restless leg syndrome. Now, see, people know that somebody's mind can be restless, but how can the leg be restless? So those who suffer, they know it, because whenever they go on the bed and lie down, they cannot keep their legs still because they have discomfort. They keep on jerking their legs, they keep on moving, and they're quite restless. Same thing when they sit in the car for a long time and for a long drive, they can't enjoy the long drive because the legs get restless and discomfort. And there, one of the things which have been found in all the studies is that they are iron deficient and they come to us. So when we supplement iron and this few simple medications, their years of agony vanishes, just like that. And then briefly about thiamine. So thiamine is more common in alcoholics, those who are alcohol dependent. And also sometimes in pregnancy, thiamine deficiency can occur. So that can cause also cognitive changes and what is called ophthalmoplegia, vision problems, and imbalance while walking. That's luckily not so common, but we should be alert. And sometimes after post-bariatric surgery, so many people, it's become a fashion for people to go for bariatric surgery because nobody wants to do the hard work of exercise and nutrition. So they just go for surgery and they lose. But there are clear-cut guidelines who should go for surgery. Not everyone who's overweight or mild obesity should go. But one of the complications we see after bariatric surgery is thiamine deficiency. And we had a young gentleman, 25-year-old, who was brought with his mother, and then he was quite disabled because he was wobbly, he couldn't see properly, and thiamine deficiency was the cause. With treatment, luckily, he improved.
How about vitamin D? Can you throw some light on this?
Yes, see, vitamin D is like, it's one of the most common. Again, patients blame us saying that, doctor, one thing you are doing is that why vitamin D was not so, deficiency was not common 20 years back. I said they were always common, just the awareness has increased. Then they blame about the levels of vitamin D. That partly I agree. So in our population, 30 may not be the cutoff. We have to have little lower threshold for treating this thing. And then of course, vitamin D is not water soluble like B12. So everyone should not take, too much of supplements because vitamin D toxicity is a reality. We have seen few patients with that also. But if you look at the symptoms, the common things are musculoskeletal. So vitamin D is mainly required for bones and the muscles. So you generalize aches and pains, back pain, leg pain, and also those who are athletes or those who do workouts, they tend to get tired or fatigued easily. So it's very important for them. It has also been implicated for immune functions. So immune functions, and then there is a linkage of, say, autoimmune diseases like, say, multiple sclerosis. There are some papers which show that those who are deficient, they can have more severe disease. And so it is recommended that we supplement MS patients with, vitamin D as well as B12. And there are few papers done by my colleagues where they showed that vitamin B12 deficiency and vitamin D deficiency both can increase the risk of strokes. So B12 we know because it is closely linked with high homocysteine. And high homocysteine is one of the risk factors for ischemic stroke as well as myocardial infarction. And in many Asian countries, that data has been shown. And same thing was shown with vitamin D also.
So what could be the reason for these deficiencies? Now, you do say that, okay, earlier it was there. Was the prevalence lower earlier, or now was it that they were not tested earlier and now? Is it because our food environment has changed? Is it because our lifestyle has changed? Considering all these factors, what do you think would be the reason for deficiency of two important micronutrients? I'll ask only B12 and vitamin D.
Okay, let's take it one by one. So B12, it's not, see, we are not biased against, I'm not biased against vegans or vegetarian or non-vegetarian. It is a personal choice. And I respect dietary choices of everyone. For whatever reason somebody is practicing, nobody should say that, because we have canine teeth and so we are all carnivores and omnivores. Okay, that's your choice. But if somebody has chosen to be vegetarian or vegan, that's their choice. But one thing scientifically we know that those who are on purely plant-based diets, means who do not consume any animal source foods, so they will be vitamin B12 deficient because B12 is found only in animal source foods, which can include dairy products also, and of course all kinds of meat, chicken, fish, eggs, all those things also. And so if you just look at the dietary sources, the meat eaters or the fish eaters or egg eaters, they have more availability of vitamin B12. Those who are vegetarians but consume dairy, they also will get a good amount of B12, provided they consume, at least twice in a day and on regular basis. Somebody says, okay, I'll have just, one glass of milk, or because I'm having tea with milk, I will get it. So that may not be the truth. So they need to consume adequate amounts. Now, so that leaves, almost 100% of vegans and one third to half of vegetarians because of dietary lack in their of B12, they'll be deficient. Now, one more important thing we have to remember is that there could be absorption issue. So many people could have antibodies in the gut, which doesn't let the B12 in the diet get absorbed properly. So that is why at least one third or 40% of non-vegetarians who eat adequate amount of meat or fish, they also could be B12 deficient. And for the same reasons, vegetarians who consume dairy also can be deficient. So even if we have adequate amounts in the diet, we could still be deficient because of the absorption issue. And there is one more disease called as chronic atrophic gastritis. Forget that term. So basically, in the inflammation and the absorption of the gut is impaired. So B12 doesn't get absorbed. So that on the earlier days, we used to do endoscopy, do a biopsy and confirm all that. But basically now what we do is that if somebody has symptoms which are suggestive of B12 deficiency, we can test it and then we can confirm it. And if you look at say vitamin D, why the people are deficient? They'll say in our country has a lot of sunshine, but why are people still deficient? So for that, one or two reasons are there. One is I think our dressing sense. I'm not saying our dressing sense is not civilized. We are good culturally, and we have a good culture of at least women, dressing properly, or even men for that matter. So most of our skin is covered. So even if you are exposed to sun, the sun has to fall on the unexposed, on the uncovered skin. At least say good amount of skin exposure is required to the sun. But our dressing is not proper for that. So men, if you are wearing say bunion and shorts and then exposed to 20 minutes of sun will get it. But how often we do that? And now in today's modern lifestyle, if somebody sees a sunset or sunrise, he starts posting on the Facebook that today I saw a sunrise, today I have seen sunset. So it's not common for people to see sunsets and sunrise. That means they're indoors most often. And that is one reason. Second thing is supposed to be our pigmentation, our skin color, pigmentation. This also, doesn't allow the sunlight to properly get absorbed and convert and form the vitamin D. So these are two common issues. And that is why most studies have shown that if you look at the standard cutoff of earlier 30, as you mentioned, almost 80% of population will be deficient. Even if you lower it down to, let's say, 20, still about half the population could be deficient.
See, can you tell the viewers what is the optimal way or optimal time also to get vitamin D? Again, you did mention, but what about the optimal time?
Yes. No, that's a very important question because there is a fear or risk of skin cancer. So if we are exposing our skin to sunlight for a long duration, or especially based on the UV index, then there is a real risk of skin cancer, even though it is not so common in our population, but it is one of the risk factors. So we have to maintain a balance. We can't be totally, exposing for indefinite amount of time. And also, I would like to say that if women or men they apply sunscreen and go out, then again we are, not going to get the vitamin D. So it should be without the sunscreen application. And then even if we are say sitting inside and then the sunlight is coming through window, again we won't get it. So it should be the direct sunlight falling on the skin. So roughly about if somebody can spend say 50 to 20 minutes, even 3 days in a week. So which means around say 45 to 60 minutes of sunlight light exposure on person who is wearing let's say bunion and shorts. So that much of so entire arms and from thigh below it's exposed at least for men and women also they can probably use some part of the house balcony or where good sunlight comes or nowadays in cities definitely shorts can be permitted. So that is what we have to see and then so that amount of sunlight exposure in a week should be sufficient. But as I said, because of our skin color, we could still be deficient. So definitely we need to test also and then supplement if we are deficient.
What about the timing? Morning, afternoon, evening?
I think it depends on the the UV index. So basically, possibly the best time is supposed to be say between 10 to 12 or 12:30. But if it is feasible, that is. So I think what can be done is it may not be feasible for the working people, but whenever it is possible, definitely we have to expose.
Now we think we are taking balanced diet and everything is happening. There is also huge influx of all these processed foods and all. How do you think these are affecting people neurologically? I mean, we know that they may be the cause of the deficiencies, but in terms of affecting neuro and possibly even neuropsychiatry, if you can tell the impact of this processed food addiction.
No, definitely, it's a big problem. It's not a solution. It's a big problem. So ultra processed packaged foods, that is one, and also processed foods. So ideally, it should not be part of our diet at all. But now, it is not possible in today's world. So they say, okay, at least about don't exceed that by 20%. So whatever you eat, keep that ultra processed part to below 20% of your food intake. Now, there are various reasons for that. Number one is that they are generally high calorie and high in carbohydrates, which is not good for anything. Well, you take any disease, overweight, obesity, diabetes, hypertension, dyslipidemia. Why we talk about all that is because they are the risk factors for all neurological diseases. The biggest killers today are heart attack, stroke, and cancer. So stroke is neurological disease. And if you look at the lifetime prevalence of stroke, it is 1 out of 6 people. So today, if somebody is born, so we know that out of 6 kids who are born, one will get stroke. And if you look at people aged 40 and above, it is 1 out of 4. So 25% of them will get a stroke. And so prevalence is increasing. And one of the things we have to look at is diet also for that. And then second thing is there is a role of gut microbiome in not only inflammatory conditions or like say strokes or say demyelinating illnesses like MS, but even neurodegenerative conditions. So today we know that diseases like Alzheimer's disease and Parkinson's disease, gut has to play a major role. And the intake of ultra processed packaged foods and processed foods, they alter the gut microbiota a lot. And that is one of the implications. Many people with migraines also, they tell me there are specific foods they tell if I eat this I get triggered, and most of them will be ultra processed foods only, like say chocolates or many other items. If they eat, they say whenever we go out and eat, then we get it. So we know what is there in those foods, what is different from our home cooked food. So that is what I see. So many of the diseases are directly linked and many are indirectly linked. So after many years, they have the effect. So that's an important part, and which we are facing, major issues with that.
Now, we'll just touch upon a different topic like sleep deprivation. So how does sleep deprivation affect us? And I wanted to answer in two parts. One is general and one is neurological.
Yes. See, if somebody has to ask, what are the 3 pillars of good health, without medicines. Many people want pill today, something called polypill. Pharma companies are interested in making polypills. We had some polypills, a few decades back also. So the real polypill today is good sleep, good food, and good exercise. So if somebody wants the 3 pills, for good health, these are the ones, and good for health as well as neurological health also. Now, in that, I mentioned sleep as the first one. See, it may appear as sleeping is the simplest thing. Our parents also used to tell, if you sleep, means you're going to lose in life. So, the achievers don't sleep much. And if you look at, some very successful people in our country who also claim that they don't sleep much, including our leaders also. I should not take the name, but, that cannot become an example. So basically, there could be exceptions. So, we salute to those people who are managing with less sleep. But if you look at, say, large observational studies or randomized controlled trials, so we have to look at, we can be like the majority. To become an exceptional person, it's like rare. Once in a blue moon or once in 20, 30 years, we get, people like, Sachin or, like that. So we cannot all become the high achievers. So yes, so definitely we need to sleep for 7 to 9 hours. I'm talking adults here, not kids and very older people. They may have differences. And then not only that, we also have to be sleep, have consistent sleep schedule. So by that, what we mean is we have to fix a time, initiate the sleep at that time, and then sleep for 7 to 9 hours after that. So sleeping less, that is sleep deprivation, and oversleeping, that is more than 9 or 10 hours, both are harmful for health. And then about afternoon nap, always this question comes. So most of us require very short nap or no afternoon nap till the age of 60. So if somebody is not napping in the afternoon, doesn't mean that they are abnormal. Most of us don't need. If you need also, suppose you have to work, if you had a very busy day, started working at 7 and you have to keep on going till 7 p.m. or 8 p.m., it is useful to have a nap of 10, 15, 20 minutes, definitely not exceeding 30 minutes. But culturally or genetically, there are one group of people, like, I know that some parts of Bengal and Gujarat, where culturally they sleep for say good 2, 3 hours in the afternoon. But that is part of the culture and they have been doing it for generations. So that group is different. I'm not talking about that group, but most of us. So I think there are 3 main things. Then the question comes about people who do night shift duties or shift duties. Of course, in today's world, when the world is working 24 by 7, we cannot say everyone should stop working at night. In my own profession, medical profession, we cannot do that. So yes, so in those group, what is advisable is still they have to at least, if somebody have consistent night shift duties, then make a schedule, daytime they can sleep. And in the worst situation, then they can have something called as biphasic sleep. So if they could not complete the quota at night, then they can complete that, say, 1 or 2 hours missing sleep in the daytime also. One more research paper said that if somebody could not get enough sleep in those 5 days of the week, they could have a catch-up sleep in weekends also. So there's a lot of emphasis on the sleep. And why is it so? Because sleep or sleep deprivation is linked to a multiple number of illnesses. If you look at this, and there are many number of research papers, so I did not say that they are not proven, so they are all proven. So higher risk of overweight, obesity, type 2 diabetes, hypertension, heart attack, stroke, certain forms of cancer, dementia, depression, anxiety, and even premature death. So if you look at this list, it's very exhaustive, and few things I may have missed also. Coming specifically to neurological diseases, both stroke as well as dementia, they are more prevalent in people who sleep less or they oversleep, and even those who are suffering from known diseases like migraine. So people with migraine, lack of sleep is the commonest trigger for them to get the headache next day, in addition to stress. And same with epilepsy. Those who have already suffering from epilepsy, if they are sleep deprived, they have a higher risk of getting seizure. Seizure recurrences are more common. So sleep is closely linked, And then if you look at say acute effects of sleep deprivation, many of the driving, errors or driving accidents, road accidents, they are linked to two major factors. One is alcohol and then driving, and second is sleep deprived driver. So driver who hasn't slept properly is more likely to be involved in vehicle crashes. And then there's our temper tantrums, and then productivity at work, ability to focus, concentrate. So many of these things get affected. Many students feel that now it's the exam season also, that let me burn the midnight oil, and then let me study for 16 to 18 hours and I'll do well in the exams. But that is not so, because consolidation of memory occurs during sleep. So if a student doesn't sleep properly, he's unlikely to do well in the exams. So good amount of studies with good amount of sleep will make a person do better in exams also.
Will any micronutrient deficiency impact sleep, or will it cause sleeplessness or disturbances in sleep?
Yes, sometime back we were talking about restless leg syndrome. So iron deficiency is one of the bigger factors linked with RLS, restless leg syndrome. So those people have impaired sleep as one of the main presenting symptoms, because whenever they are still or they are resting, the symptoms are more. So during night sleep or while prolonged long drives. So that is one thing. In B12 deficiency also, because deficiency of vitamin B12 deficiency can lead to anxiety, depression, and those illnesses, one of the symptoms are sleep disturbances also. So as a result of that also, and then neuropathy also, I mentioned that they can get burning or tingling in the feet. Again, that can cause sleep disturbance.
Very often we find that even in X, you have been supportive of low carb approach. So what is your experience in some of the patients, neurological patients specifically, on the low carb approach? Have you seen some improvement? Because I know you support low carb. If any patient comes and tells you they're doing low carb, you will never say no and you'll only encourage. But what are the improvements you have seen in certain neurological conditions?
Yeah, I think this word low carb had to be propagated by your team, and rightly so, because our diet is high in carbs. So the opposite of high has to be low. From our childhood, if you see our plates, two-thirds will be rice, or two-thirds will be roti, and small amount of vegetable and dal. That is what our traditional meals are. And we realize that that is the culprit for most of the metabolic disorders that we see today, and those metabolic disorders are linked to neurological diseases. So as I mentioned, so migraine, as well as this our strokes, dementia, so all of them are higher in people who have overweight, obesity, and diabetes and hypertension. And so low carb approach has been found to be useful in controlling this or reducing the risk of all these metabolic disorders. And then your team has been doing a good work in that area. And I agree with that, because see, many people say my grandparents were eating, rice 3 times this thing. They lived up to 100 years. Of course, it may be correct, but you can't just isolate the diet part. See there, the minimum they walked was 10 kilometers in a day. Those days there were no two-wheelers or cars, no elevators, no escalators. So everything had to be done manually. They were working in the fields. They were cultivators. They were farmers. So of course, our lifestyle today is different. So So definitely, low carb works. So low carb will reduce the number of risk factors for stroke and dementia. And those are already suffering. Many people with migraine, they come and tell me, doctor, when I stopped sugar, what does it mean? Stopping sugar is part of low carb. Okay. And they feel better. So definitely sugar is something which we don't require in our diet. So there are some things essential, some are non-essential. So salt is essential. We need salt. But many people say all the white things stop. It's not like that. See, salt is essential. We cannot stop salt and survive. But sugar is something we all can stop and survive also. And sugar is something, it's a craving also, because if it's like alcohol, so it stimulates the reward center in the brain. And so it is linked to brain happiness also. So we have to, once initially it may be difficult. I myself have experienced this. So from 5 gulab jamuns in a day to zero, like once in a blue moon. So definitely first few weeks or months it may be difficult, but it's easy after that. So many patients do tell me that after they stop sugar, the migraines frequency has reduced. They're able to come off the medications also. And so that is how it is closely linked to many diseases.
So how now we are talking about low carb. Whenever we say low carb, we always in D life and others we mention about the 100-gram maximum template of carbs as propagated by Anup Singh for quite long time. So that comes in the low carb. Now in the other end of the spectrum, we go towards ketogenic diet. Now the application of ketogenic diet in epilepsy is already well known. It was formed by Russell Wilder quite long back. Of late, we are seeing a lot of plethora of case studies, reports coming in. The application of the newer ones, neurological country like ALS, Parkinson, dementia, Alzheimer's. What is your view about the application of ketogenic diet in these neurological conditions?
As you mentioned, this ketogenic diet in epilepsy is well proven, and there also it works in refractory cases. So patients who have stopped responding to medications, their ketogenic diet works. So I think so. Then, if you look at the hierarchy, that will come on a much higher pedestal than, let's say, even anti-seizure medications, because the medications have failed, and then the ketogenic diet works, and especially in many children. So we have seen that. Now, regarding other usefulness, I definitely feel they'll be useful, and there are three major diseases where case reports and small research studies also have been published, and they are multiple sclerosis, Parkinson's disease, and Alzheimer's disease. Now, theoretically, also it's plausible. It's not that just off the hat, the propagators of low carb diet are telling use it. So there are a lot of things. As I mentioned, some time back, these are all less inflammatory, food. So they are known to reduce inflammation. So if you look at the inflammatory markers in a person who practices low carb diet, they are much lower. And we know that inflammation is the root cause for many of these diseases, including multiple sclerosis, Alzheimer's disease, and Parkinson's disease also. And then they have a bearing on the mitochondrial functions also. And the most importantly, neurogenesis. See, both Alzheimer's as well as Parkinson's, they are neurodegenerative diseases where the brain neurons they start dying and prematurely. So the low carb diet has also been linked to neurogenesis. Of course, these are all initial small studies, and we need more studies also. And then the most important is the modulation of the gut microbiome. So I mentioned that there is a role of gut microbiota in causing many of these neurodegenerative diseases. So those who take low carb nutrition, they have much better profiling of their gut microbiota. So the unhealthy microbiomes are less, and the healthier microbiomes are better in them. So these are the possible mechanisms. So my feeling is that in the next say 4 to 5 years, we should have definite guidelines. It will come in the mainstream neurology also. As of now, few of us are propagating. I don't practice myself, but I refer them to experts like you and your team to guide them, because I am not the expert in low carb nutrition.
But you do practice in the sense for yourself, you do practice low carb to a good extent, I think. To a
Yes,
good
yes. For myself, I can practice. Like many people, they say that doctors, you have killed us with the COVID vaccines. But but if you remember the COVID vaccine, the first all the doctors have taken it in India or most countries. So it was not because it was experiment on us, because we were more at the forefront and we were more exposed to COVID-19. So that's why we were given first, and then the elderly who were more at risk. So similarly for low carb nutrition also, it's not that we are imposing on those who don't like low carb. Doctor, you are going to kill us and starve us. See, our grandparents lived, and you're telling us not. If I don't eat roti and rice, what will we eat? That is our main food. So many people tell me. Doctor, what can I eat then? If you're telling no roti, no rice, or just one roti or little bit of rice, then I said yes. If you're non-vegetarian, there is plenty of food. There is chicken, there is fish, there is meat. There are so many things to eat. Then the vegetarians say, then I said, okay, fine. Listen, if we have good nutritionists, and they can definitely fill your plate with your low carb diet also.
I also want see you must have seen uh, in X and social media, primarily the insulin resistance, something which all the low carb people only keep talking. Now I know for you for sure that I've seen your lab report. I also analyzed your lab report. There you have very good insulin resistance score, very strong HOMA IR case. So just tell the viewers about your own HOMA IR, how much it is, and what is the application? Does this insulin resistance has any application in neurology and in general other practice also? So viewers will be curious to know about your own lipid profile and your own HOMA-IR.
Yeah, no, definitely I'll mention that. See, basically, people feel because the mainstream doctors, they say, do fasting blood sugar and postprandial blood sugar. If they are, fasting below 100, postprandial below 140, they say you are fine. But it is, it's the far from the truth. We are just looking at one tip of the iceberg and say, okay, and leaving the entire bombshell away. And because see, for doctors, that is what they have been taught. And then if it is more than that, see, they are interested in, when we can start the anti-diabetic medications. So obviously, till the person is diabetic, anti-diabetic medications cannot be started. But the question comes to us is, can we prevent a person from becoming diabetic? And we also know today that those who have already become diabetic also can be reversed. But we are talking one step before. Then some doctors say, okay, fine, you do HbA1c. That will tell you normal pre-diabetes and diabetes. But even if HbA1c is, let's say, below 5.6, which is supposed to be normal as per the labs, are you still normal? The answer is no. Because we know that people can have insulin resistance, and that is linked to all the diseases. So today what we see, whether it is stroke or say even heart attack, if you see research papers, so the risk starts increasing from insulin resistance itself. So insulin resistance, little risk is there. Pre-diabetes, the risk is more. Diabetes, risk is higher. Uncontrolled diabetes is the highest risk. So it's like a step ladder pattern. So we have to hit the person or take action at the stage of insulin resistance itself. It's not that we can continue to eat 5 gulab jamuns and high carb diet if you're insulin resistant, because invariably after a year or two you'll be pre-diabetic. Another 2 years down the line you'll be diabetic. So that is what happens. So this knowledge, I have to accept it was not there with me, say till about 5 or 6 years back, because it is not mentioned in our usual standard textbooks. Even if it is there, it may be just one paragraph, and then we have 10 chapters on various things about diabetes. And even there, it's quite funny. You have to take some three major meals and three minor meals. For a diabetic, what will happen? So a lot of those traditional books need to be changed. I hope they are changed now, because I haven't read the MBBS books now, but it was not like that when we studied. So if you look at insulin resistance, I'm sure it's mainly for the viewers. So basically, one is to you look at your fasting serum insulin, then fasting blood glucose, and then now we have other surrogate markers. So for that, we need HDL cholesterol and triglycerides. So if you have these four values, which are of these three are always done. So only additional tests required to be done is insulin. And if you have insulin and fasting blood glucose, this HOMA IR can be calculated, which is one of the standard markers, easy to calculate. So there was a time when I used to have insulin resistance going up to almost HOMA IR was more than 5 or 6. But now routinely it will be around 2 or less than 2. And then the other thing was, my triglycerides used to be 300 plus. So this was about 5 years back. And HDL cholesterol was 32. So you can imagine 330 means almost ratio of 10. So I'll be like severely insulin resistant at that time. Then slowly the time came when this triglycerides started dropping to 200, 150. And now triglycerides are 43. And HDL cholesterol gradually started climbing from 30 to 40 to 53. So 43 and 53, that's the ratio now. From 300, 300 has dropped to 43, and then 32 is now 51, 52, like that. So definitely that ratio has improved. And and one of the things I have to say is, and one more indicator is something called as triglyceride glucose index, which also can be calculated, which can give a surrogate marker for insulin resistance. So all these values are there in our report. We have the calculators on the net. We can calculate. So it will help us to, take action from before, because most of us want some kind of shock or a reason to start practicing low carb diet. And if we wait for HbA1c to cross 6.5, it will be too late. We have missed the bus by then. Okay, so that is what I would like to say here. That start looking at these parameters. And your second part was insulin resistance and disease. Already I mentioned briefly, but definitely the risk of hypertension, diabetes, and all the other stroke and other say even migraines. So most women with migraine, if you check the insulin resistance, they have insulin resistance, polycystic ovaries, hypothyroidism, they are overweight or obese, they have acanthosis nigricans. The moment I look at their skin, I know that they'll be insulin resistant. So it's not the cosmetic issue. Many girls think that having this black mark on the neck or the axilla, it's a cosmetic issue. They go and see dermatologist who may give some cream. But we need to look at the underlying reason why it is so and treat the underlying disease, not the cosmesis, not the outer beauty. We have to look at the inner beauty. That is the lipid profile, insulin levels, and glucose levels.
So briefly, I will say that you are always a model doctor for many people, because it is not that you take care of a patient, but you take care of yourself also. And I think that is what is needed very critically in medical profession also, because we have seen one report which has come from Jamnagar, where they found that people in the primary tertiary care, I mean doctors in primary tertiary care, 50% of them are having diabetes and 36% having hypertension. So what all things you do to keep yourself healthy?
Yes, doctors also live 10 years lesser than non-doctors, and that will come as a shock because we are supposed to save lives and prolong lives. But doctors are dying earlier, so doctors generally do most of the things that we should not do. So, and even I was part of that crowd earlier. So basically, one thing I don't compromise is my sleep now. Of course, on the emergency duties, that is different. But when I'm not on call, I ensure that I sleep 7 to 8 hours at night. Other thing was I was not doing physical activity because so much of work is there. There is no end to work. Most of us who are good at work, we can find enough amount of work to keep us ourselves busy. But that should not be so. We have to find 40 minutes or 60 minutes or whatever time on a regular basis for exercise. And that is what I do. Meaning I started running from a person who could not walk much. I can run half marathons easily. You can wake me up at 8 of the morning, and then in 2 hours I can run 21 kilometers. So it's easy. I enjoy that. That's why it's good. And then till about 2 years back, I was not proper gymmer also, but now I do strength training because I was losing muscle. So that's on the exercise front. Regarding stress, I never took stress because I enjoy life, and I enjoy my work. So, but yes, many people do have stress, but I suggest to them that it is not good to be under stress. And diet is something which we already mentioned. So I have finished my quota of sweets for the entire life, maybe for next life also. So now I don't need any more sweets. So I have cut down drastically on sugar and sweets. Occasionally I may have, but and soft drink was another of my weaknesses. So, but I haven't had a soft drink for a long time, including diet soft drinks.
Thank you. So there are two things now. What is your message to India and your message to Metabolic Health Conference and D-Life? That's the second part. So what is your message to India?
See, message to India is that I know that most of you don't like doctors, hospitals, and pharma companies. That's a good thing. But also you should not like diseases, because unless you have a disease, you will not reach a doctor. So try to remain healthy, and we already discussed how you can be healthy. And so that is best thing. So focus on your sleep, diet, exercise, and stress-free life, and this thing life, and spend time with your family, friends. Do things that you enjoy. And I think D Life is doing a great job. So basically, the message has to go on. We still have a small number of people who feel that they should be like their grandparents and eat a lot of carbs. But I think you are doing a great job in by propagating that low carb is the way to go. For most of us, even if we do not have any metabolic problems, see, why wait for a problem to begin? If we can act now, we can avoid that. And there are many examples, including you and Anup sir, who have been diabetics, and you could reverse the diabetes. What can be better than that? Many people don't like to take medications. That's a good thing. So if there's a method to be pill free, they have to take your help, and low carb and platforms like yours can help many such people.
Thank you. Thank you. Please get Anup Singh in. Anup, you're there? I think, okay, fine. So Anup is not there. So anyway, doctor, thank you very much for providing your very valuable insight. And I think it's going to help, your message will help India gain a lot of insights into the micronutrient part, as well as how, as a mainstream neurologist, you also favor and propagate low carb nutrition. And the third part is how you maintain yourself. That is very, very critical. And I think everything encompasses into a very good message. Thank you very much, Doc. And we look forward for more future collaborations and work together to get this message to make India healthy. Thank you.
Thank you. Thank you. Wish you all the best for the rest of the conference. Yeah.
Thank you, Doc. Thank you.